Hi, and good evening. I'm Dr. Philip McMillan. Thank you very much for joining me as I try and take on a really important topic. I've picked this image here because I need it to be dramatic. My hope is that it will be so dramatic it causes people to really think about the seriousness of what I'm going to be talking about. So, I'll be doing a few things. I'll be talking about a paper that was published in 2022 and looking at some of the outcomes. I'll be talking about some of the basic thoughts I have about immunity and mucosal immunity. And I'll be giving some ideas as to why I think that these patterns are occurring. Now, we have to be clear about something. There are all kinds of groups of people at the moment. Some people believe that the virus is not serious. And so it's just a cold. I think that's very dangerous because the more we are learning about this virus and the origins of this virus, the more we're starting to realize that if this was developed, it's not going to have the normal characteristics of a virus. That's the most important point to reflect on. You have some people who are unvaccinated, who, as far as they're concerned, they are fine. I think that's a very dangerous perspective because of what I'll be showing you. You have another group of people who are vaccinated, and as far as they're concerned, if they're vaccinated, they're protected. That's clearly not going to be true. This is of relevance to every single cohort of individuals in a society. The only people who seem to be able to avoid this are probably in Africa, because there is no pandemic there, unless they've changed something recently. But this was always the point from in April 2022, where the pandemic was over after they had faced Omicron. We see now in highly vaccinated regions that this pandemic doesn't look as though it can be over. So let's get back to the reality of what I call the slow kill of COVID reinfection. And what I'm looking at here is a very important paper. And as I said, this paper was published in September, accepted in September 22, published online the 10th of November 2022. I have seen this paper, but for some reason I didn't actually look at it in detail. And it popped up in front of me recently. And I think that I really had to look at the relevance of it. This was from the USA, and they were looking at a cohort of people who had COVID infection and reinfection. And they compared them to a non infected control. And this non infected control here is about 5 million. So, really, a significant cohort of patients that they were looking at. They were looking at what they call the Veterans Affairs National Healthcare Database. And so this is a quite a broad cross section of people in the US. And so will give us a good idea as to the relevance as to what it is that we are facing. And what they were finding there is that when they looked at the outcomes, when they spoke about different characteristics of that population, and this is just from the summary, and so when they looked at 6 month burdens of death, hospitalization, and sequela, and they found essentially that compared to no reinfection, so you just had one infection, reinfection contributed additional risks of death 2.7 times, hospitalizations 3.2 times, and then all other kinds of pulmonary, cardiovascular, hematological, diabetic, gastrointestinal, kidney, mental health, musculoskeletal, and neurological disorder. This is what they found primarily, and they said here the risks were most pronounced in the acute phase, but persisted in the post acute phase up to 6 months and technically beyond. They just measured it up to 6 months. Now, this is extremely important, and it's relevant, as I said, to everybody. Because if you have a situation where the virus is continuing to circulate, and in one estimate I saw, certainly in the UK, they're talking about 1 in 13 people. This is, if you know 13 people on your way to work on the bus, you may have been in contact with a number of people, and everything is going to depend on how effective your mucosal immunity is. And before I go a little bit further, let me just highlight this important point about mucosal immunity. This is an image that I use all the time. In order for the virus to cause problems, so it's not just about infection. Based on my research, if the virus cannot penetrate this mucosal barrier, which I have as this black line, which is with IgA antibodies, very sophisticated, about 4 levels of protection. If it doesn't get into the systemic system, into the lymph nodes, into the bloodstream, it is unlikely to cause significant problems. But if it penetrates this barrier, doesn't matter what your vaccination status is, this is where the problem is. Because what has happened is that if you've been infected before and it has penetrated this barrier, based on my research around autoimmunity, it has primed your immune system for a more severe response, almost what I call a low grade cytokine storm. Not the same one that killed people with regards to the lung disease, but very similar in my research autoimmune response. So this is not to be ignored. So let's look at some of the outcomes that they had with regards to this. This here is again from the paper, and I find images tend to be better. When they looked, and this is across all of the cohorts, this is not just about vaccinated or unvaccinated. When they looked at all cause mortality, that means that just any cause that people died. This black line here represents what you would call the point at which, if the bar is on here, there's no significant difference. You can see down at the bottom here, they have the numbers 1, 2, 3, hazard ratio, and you can see that in terms of all cause mortality, it's all the way out here. For hospitalization, so this is not necessarily people dying, just them getting admitted into hospital within 6 months, it's all the way out here. And then look at all of the different cohorts of the organ systems. Cardiovascular and hematological coagulation are all the way out here. Diabetes is increased, but not as high. A lot of people would have fatigue, gastrointestinal symptoms, kidney disease. Goodness gracious, look how high this is after reinfection, and as well, lung responses. Neurological is still high, but not as high as these here. So pulmonary, kidney, coagulation, and hematological, cardiovascular are the main organs that seem to be involved. This is horrific stuff. And this is what is happening. The problem is that because it is relatively silent, and this is the problem, this is what I keep on saying to people. If the same number of people that were dying early in the pandemic were still dying now, but just because they're not filling ICU, you are not bothered, that's a problem. That is a real problem, because just because it's not dramatic and not necessarily so visible, it means that it can be ignored. And this is exactly what seems to be happening across the board. Here again, in the context of this is again them looking at this cohort, looking at the risk burden of sequelae in people with SARS-CoV-2 reinfection versus no reinfection by vaccination status before the reinfection. Okay? And so this is why I'm saying to people, this matters across all cohorts. So they have no vaccination, one vaccination, two or more vaccinations. And when you look at all cause mortality, this is still relevant whether or not you haven't had a vaccine. There is still significantly increased risk. Similarly, what is very interesting is one vaccination has the highest all-cause mortality. And this is a very important flag that needs to be addressed by public health. They need to figure out why the heck this would be so. Why did they only take one vaccine? Was it because they had side effects? And this predisposes people to higher all-cause mortality. Really important question. And you can see here 2 or more vaccinations. And what is very clear here is that this is still higher than no vaccination, but all groups are at risk. And so it's no longer about which one is better. You just don't want to get a reinfection. Hospitalizations across all groups, again, is very similar. And you can see going down the line, everything is beyond this dotted line. Higher risk in every single cohort. It doesn't matter your vaccination status. Granted, it's slightly higher in terms of all cause mortality, but the point is, it is still a risk across the board. This is extremely serious. There is no easy way out of it. Now, you have to remember, politicians are busy worried about their particular situation and how to explain away the mistakes that they have made, not recognizing that we are in an absolute nightmare of a situation. And I highlight this is in highly vaccinated regions because the population cannot control the circulation of Omicron. The reality, based on all the evidence, is that the immune system is still geared towards responding to the original Wuhan virus and therefore cannot deal with Omicron in highly vaccinated regions. So, therefore, it doesn't matter if you're vaccinated or not, because you're still going to have high levels of circulating virus that your immune system is going to have to battle with. And you have to remember that your immunity fluctuates. It's not always the same. And so you may find on a day that you're very fatigued or not, the virus, because you're continuously exposed to it, can break through. And that's the reinfection. The trick is how to reduce the reinfections as much as we can at this period of time. This needs some very, very serious attention. And this is why I'm highlighting this, because it is irrelevant anybody's opinions at this point. The data is telling us that this is extremely serious. So here is again another view, and this is another figure from the paper. And so again, it's showing you just in a different way risk and burden of all-cause mortality, hospitalization, at least one sequela in the acute and post-acute phases of reinfection versus no reinfection. And you can see here again, the outcome here is all-cause mortality. So what you have with is here in a timeline, 30 days, 60 days, 90 days, 120, 150, 180 days. And again, your dotted line here would represent no change. Within the first month, that's the highest risk. And you can see it here in terms of a bar chart. This risk falls off over the 6-month period, but it is still in effect over that 6-month period. And the likelihood is that it continued out even for a year. So this is across all cause mortality, elevated for hospitalization within a month, elevated for at least one sequela from infection. This would be the long COVID type of picture that could happen. And look at this after 6 months in terms of just one outcome that doesn't quite resolve, whether or not it's just joint pains or if it's just fatigue or just headaches. This is significant morbidity at the population level. And this is probably why we are seeing so many people who are out of work. This, from a health point of view, there is nothing that could be described as more serious than what we are seeing at the moment. And again, here is the other point. I'll show you one other image here, another figure from the paper. So again, the link is in the description, so you can go and take a look at this yourself. So again, this is risk and burden of sequela by organ system in the acute and post-acute phases of SARS-CoV-2 reinfection versus no reinfection. And they're looking here at the different organ systems. This is cardiovascular or heart, coagulation, hematological, diabetes, fatigue, gastrointestinal, mental health, all the way down. And you can see again that the risk is highest in that first 30 days, but it remains all the way out to 6 months. Cardiovascular seems to stand out as the most serious outcome. And this is probably part of the reason why we're seeing a number of these, what we call sudden deaths or younger people dying. And it's because of these cardiovascular outcomes. Now, you have government agencies arguing that this is not because of the vaccine. You then have another group of patients saying that this is all because of the vaccine, and they're missing the point. It is the combination. It is when you put both things together that you have these horrific outcomes. It is quite likely that if you looked at the vaccinated cohorts in areas again like Africa where the pandemic is over, you're not going to see any problems. But when you combine this, it is like an epoxy resin, two different resins in different tubes. On their own, they don't really make a difference. But when you put them together, you get something that is completely different. And this is what I describe as the slow kill of COVID reinfection. And as this continues to go, you just have to remember that as each round of infection goes, that risk increases. Now, this here is my description from an autoimmune point of view. When I started, my focus was on autoimmunity to ACE2. After 4 years, there is still nothing I have come across that more clearly explains every single aspect of COVID 19 than autoimmunity. My only difference was that I thought it was primarily ACE2 until I found that there were all these other proteins that attach to the spike protein. So you just have to imagine that this virus gets into your bloodstream and starts collecting all of these proteins on the surface of it. When the immune system picks this up, it has to assume that all of these proteins on the spike protein are part of the spike protein and therefore make antibodies to it. To me, that seems blatantly obvious. There is no other logical explanation that I can find scientifically that would explain. And again, I'm going to show you this here. Look at this. If you just ask anyone from a scientific point of view to explain how we can see across all of these systems, lung, neurology, muscular, mental health, kidney, the only thing that does this in the context of a long term, because an infection potentially can do this in 30 days, but it doesn't usually do this over 6 months. We only see this kind of presentation around autoimmunity. That's the point that I'm making. If you can find someone to explain a more logical pattern other than autoimmune responses, I'd be very happy, because autoimmunity is a horrific problem at population level, because all we can do once it has occurred is to manage the symptoms and to try and suppress the immune system. And that means lifetime of immune suppressants. And so if you don't have problems even from the infection, you can have problems from long-term immunosuppression. This is not a good outcome. And listen, more than ever, we need people to just get out of their silos. We need people to just look at the science and try and figure it out. Because if we continue to sit on this kind of situation and just let the population become exposed exponentially for months at a time to continually circulating infection and getting reinfection after reinfection after reinfection, 3 times the hospitalizations, it means therefore all the hospitals are going to be full and they will not get empty all the way through the next 2 years. It means that if you get sick, you will not get seen. And so if you don't think it's relevant to you, wait until you get sick or a loved one gets sick. Double the mortality Just imagine what excess deaths are going to look like in another year if we continue to behave as if this is not an issue. I don't know what to say to anyone else at this point, but all I know is that my concern is that this is going to become a storm surge of death. And I don't think we can stop it. But my hope is that if we apply our minds now, we can mitigate it. We can make a difference. Instead of 120 million, you may be able to bring it down to 80 or 70. But that's what I'm talking about in terms of how serious the battle is that we are facing. This is really not a time for people to pick up silos. We really have to find solutions to get out of this mess. I think that we need to worry about the people who made the mess in the first place afterwards, but let's just try and see if we can sort this out and save as many lives as we can. Have a good evening.